Yes, it is time for our weekly health watch, and as always, we are joined by our friend Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
Glad to have you back this morning. We have some interesting talkers. So there's a new study that finds kids aren't exactly getting as much sleep as parents may think. What's going on with that?
Right. So this is a regional study. It comes out of Rhode Island, and this study looked at 102 kids. And looked at how well they were sleeping or not well, and mirroring that or looking at then parents and what their perceptions were of their kids, whether they were getting sleep or not. So the American Academy of Pediatrics recommends for ages 9 to 12, 6 to 12, 9 to 12 hours of sleep. Now, what was happening here was the parental side of the study was, okay, my kids are getting enough sleep. However, the kids were monitored using an accelerometer. So basically, they were getting less than 9 hours of sleep, even though parents were thinking they're getting 9 to 10 hours of sleep. So what's happening here is it's probably taking longer for kids to fall asleep. And then how frequently do they wake up? Are they getting proper sleep? And so we need to go to the basics again, tried and tested. Make sure children have a sleep routine. They wake up at a certain time, go to bed at a certain time, even on weekends. Make sure they get enough physical activity, light exposure. Keep the screen time away from around bedtime. Keep those screens away would be important too. So making sure that parents are aware of all those points.
Yes, Papa Privet was pretty strict with my bedtime. 9 o'clock. He's like, go upstairs. It's time to go to bed.
Makes sense.
All right, now moving on to our next topic. A lot of folks, when they work out, they tend to go for a protein shake afterwards. So, keep the gains going, rebuild the muscle. But there's a study out that says that may not be the best option.
So let's talk a little bit about this. So this is a Canadian study looking at a small group of young adults who were randomized to two groups. One group had, after exercise, got Greek yogurt, so a fermented dairy product. And then the other group got pudding, which was rich in carbs. Both had the same calorie count, though. And they were followed for 12 weeks. They worked out. They had an exercise regimen. Both groups had the same exercise regimen during those 12 weeks, at least 3 days a week, followed by, usually after a workout, either taking the eating the yogurt or the pudding. And what the study found was they looked at biomarkers, especially inflammatory biomarkers. And the group that was randomized to the yogurt actually had a really good profile in terms of suppression of the bad biomarkers, inflammatory biomarkers like tumor necrosis factor and interleukin 6, which was also higher. So things like that point towards a healthy product after workout being more beneficial.
Awesome. Well, it's good to know that you have another option out there because sometimes, at least I'll speak for myself, I don't always feel like drinking the protein shake.
Right.
Some of them are not
right. Now,
delicious.
Here's the point, though. It didn't compare. So
the pudding, pudding.
For transparency reasons, it didn't compare one protein product to the other. Yeah. The take-home message here is make sure you're eating something that is healthy.
Yes.
High in protein content, and preferably, based on this study at least, a dairy product wouldn't hurt.
All right. Now we've got one more to get to. Scientists have done some research and they believe they've learned a little more about why it is so hard for some folks to stop drinking.
Yeah, this is an interesting study, Symphony, out of Scripps, California. And basically it was a study done on rats and how they react to continued alcohol consumption. And so there were changes in the brain, especially in an area in the brain that is responsible for emotions, for stress, how we manage those emotions and stress. So basically, there are changes that will then lead to people becoming more and more dependent. Why? To actually avoid those withdrawal symptoms that may happen during alcohol withdrawal. So it's an interesting study. More research is needed, and it may lead to more medications or interventions that can help during this period.
Alrighty, well, thank you so much for joining us. Those were some good talkers today.
Yeah. Absolutely. As always.